Hello, my name is Salma Jabbour. I am Professor and Vice Chair of Clinical Research and Faculty Development at the Rutgers Cancer Institute of New Jersey, Rutgers University in New Brunswick, New Jersey, USA. We know that with checkpoint inhibition following concurrent chemoradiotherapy, such as in the Pacific trial, that overall survival and progression-free survival were significantly impacted in a favorable sense, that it really helped patients. But the issue here is that in those situations where patients are finally receiving immune checkpoint inhibition, several months may have passed. For example, by the time a patient starts concurrent chemoradiotherapy and then recovers and then begins on immunotherapy, a solid 3 or 4 months may have passed. And this could certainly put the patient at risk for experiencing distant metastases even in that short interval. We know that concurrent chemoradiotherapy provides good but not optimal 5-year overall survival rates and does not sufficiently reduce the risk of distant relapse. We also know that in the advanced setting of non-small cell lung cancer, that we can expect pembrolizumab with platinum doublet chemotherapy to improve overall survival irrespective of PD-L1 status. For this reason, we were involved in performing the KEYNOTE-799 study, which is an open-label phase 2 non-randomized study that evaluated patients with stage 3A to stage 3C locally advanced unresectable non-small cell lung cancer. These patients could be assigned to one of two cohorts. In patients who had non-squamous histology, they could be included in either cohort A or B. And in patients who had squamous histology, they could be included only in cohort A. In cohort A, patients went on to receive 1 cycle of carboplatin and paclitaxel with concurrent pembrolizumab, followed by concurrent carboplatin, paclitaxel, pembrolizumab, and daily thoracic radiotherapy, followed by pembrolizumab for a total of 17 cycles. In cohort B, patients received the same sequence of chemotherapy and chemoradiotherapy and pembrolizumab, employing cisplatin and pemetrexed. The primary objectives of this study were to evaluate objective response rate as evaluated by RECIST version 1.1 by blinded independent central review. And another objective was to evaluate the percentage of patients who experienced grade 3 or higher pneumonitis. The findings of the study were very encouraging. With regard to objective response rate at 6 months with a data cutoff of January 3rd, 2020, we found that the objective response rate in cohort A was 67% at 6 months, and in cohort B was 57% at 6 months. We also recognize that the median duration of response has not yet been reached. In addition, patients had very promising progression-free survival and overall survival rates. The overall survival rates were in cohort A were 87% and 95% in cohort B at 6 months. Both median progression-free survival and overall survival rates have not yet been reached. With regard to the rate of grade 3 or higher pneumonitis, this was assessed regardless of follow-up duration. And in cohort A, the rate of grade 3 or higher pneumonitis was 8%, and in cohort B, it was 5.5%. These rates of pneumonitis are those that have been well established and accepted with using pembrolizumab monotherapy in the advanced setting of non-small cell lung cancer and for concurrent chemoradiotherapy in stage 3 non-small cell lung cancer. It's a little bit hard to know if those are truly different numbers in cohort A versus cohort B, partially because cohort A has fully accrued and cohort B is still accruing. So we might find with longer follow-up in cohort B that both cohort A and B have similar pneumonitis rates, or it's possible that because cohort A contained both squamous and non-squamous patients, that potentially squamous patients may be more at risk for pneumonitis. It's still too early to tell. The important things to understand about this study are that we still need additional follow-up, that these are interim results, and in this space, it will still be very important to have phase 3 studies that compare novel combinations like this of concurrent chemoradiotherapy with checkpoint inhibition in larger cohorts and comparing it to the standard of care. The one very important question that this study, KEYNOTE-799, is trying to answer is whether or not this early checkpoint involvement with pembrolizumab can affect not only progression-free survival, but overall survival. These are not primary endpoints of this study, I should be clear, but I think that this phase 2 non-randomized open label study will give us a signal as to whether or not this will carry additional benefit for patients beyond incorporating it after chemoradiotherapy.